In long-term care, we aim to provide you, your family, visitors, volunteers, and staff with a safe and healthy living environment. Healthcare providers are not the only ones responsible for ensuring your safety. You and your family have a lot to offer towards the safety of your health care. You can ensure a safer experience by being involved and informed about your care and treatment. This video will focus on you and your family's role in helping to make your care safer. We will discuss your role in good communications, infection control, safe care, and maintaining a safe and healthy environment. Good care requires constant communication between you and your healthcare providers. Good communication means on a day-to-day basis you can ask, listen, and talk with us about your care. Ask us. If you have concerns about your care or don't understand something, ask questions. Ask questions until you feel comfortable with any treatment options, instructions, or health advice. Listen. Listen when talking to your doctor or a healthcare provider. If you do not understand, then tell them you don't understand or ask for further clarification. Talk. Talk openly about any health wishes, questions, or concerns you may have. Let us know how you are feeling or changes you may be experiencing. In addition to the daily discussions with your healthcare team, there are other ways to communicate with the people who care for you. These are resident care conferences and resident and/or family councils. Resident care conferences are meetings that allow you and/or your family to talk with your healthcare providers. It is an opportunity to review your care plan and discuss any questions or concerns you may have. A resident care conference will be scheduled following your admission to the home. Additional meetings may be held in the future if required. Resident and/or family councils provide an opportunity for you and your family to contribute to the overall operation of the home. Through resident family councils, you and your family work with administration and staff to create a home environment that meets the needs of all residents. It is also important that you let your health care providers know what your wishes are for your health and care, even if you become ill and cannot speak for yourself. As part of your admission, staff will talk with you about your care and treatment wishes. We need to know your thoughts about important medical decisions, such as your thoughts around cardiopulmonary resuscitation. Cardiopulmonary resuscitation, or CPR, is the treatment used to try and restart a person's heart after it has stopped beating. Even if your risk of needing CPR is low, your healthcare team needs to discuss resuscitation with you. Your wishes around CPR and other important medical decisions are documented on your medical chart. If you have no documentation indicating otherwise, CPR will be performed. An Advanced Healthcare Directive is a written statement of your healthcare wishes and is used only when you are ill or injured and unable to communicate your healthcare wishes to others. You will be given information about completing an Advanced Healthcare Directive if you've not already completed one. You will also be asked to name a substitute decision maker. A substitute decision maker is the person you want to make healthcare decisions on your behalf if you become ill or injured and are unable to tell us your healthcare decisions. If you do not name a substitute decision maker and are no longer able to tell us your wishes, your substitute decision maker will be determined according to the province's Advanced Healthcare Directive Act. Generally, this person will be a family member or a close relative. To prevent the spread of germs, we practice and promote infection control. Hand hygiene is the best way to stop the spread of germs because germs can live on your hands, objects, and surfaces. Hand hygiene refers to washing your hands with soap and water or using an alcohol rub to clean your hands. It takes at least 15 seconds to wash your hands properly. This is about how long it takes to sing Happy Birthday to you. It involves 5 simple steps. Think wet, lather, scrub, rinse, dry. In your new home or when visiting, you should clean your hands before eating food, before and after being near someone who is sick, after using the toilet, after blowing your nose, coughing, or sneezing. To prevent the spread of the infections, we offer immunizations like the flu shot to all residents and staff in our homes. If there is an outbreak of a particular type of infection, such as influenza, which we know as the flu, or gastroenteritis, often known as the stomach bug, the home may restrict staff and resident movement in the home, and/or they may also restrict visitors and delay some social activities. If you are planning to visit a resident and there's an isolation precautions sign outside of their door, check with the nurse before entering the room to find out what steps you may have to follow first. We have implemented a number of safety initiatives to help us provide you with safe care. We would like to tell you about some of these initiatives and how you can help us. Eastern Health has a positive patient identification policy to help us ensure that the person receiving any treatment or procedure is the person who is supposed to receive it. You will be asked to wear an armband, which staff members will use to identify you. You will also be asked to have your picture taken when you move into the home. Your photograph will help us ensure that you are the right person for whom we need to provide care. It is important for everyone on medications to be aware of what medications you are taking and their purpose. Your medications will be provided by the pharmacy, and our nursing staff are available to administer them. To ensure the medications you receive are appropriate for you, they will be reviewed throughout the year. Reviews reduce the chances of errors with your medication, the use of too many medications, and interactions that can impact your quality of life. We also work hard to prevent falls. All residents are assessed for fall risk when they are admitted to a home and throughout their stay. Working as a team, we identify ways to reduce your risk of falling. These include making changes to your environment and asking you to follow our recommendations. Things we will recommend include using handrails to assist you in the hallways and washrooms, asking for assistance if you need help getting out of the bed or to the washroom, and ensuring that your bedroom is free of clutter and nothing is on the floor, such as mats or throw rugs, as well as wearing non-slip shoes and/or slippers with back supports. Some of our residents are living with dementia. Dementia impacts the way a person thinks, feels, and behaves, along with memory problems. There are many types of dementia, but Alzheimer's disease is the most common. Sometimes residents with dementia or other illnesses need special care, such as WanderGuard or a secure unit like the Protective Care Unit, also known as PCU. When visiting one of these units, it is important not to bring in items without checking with staff first, as everyday items may cause harm and may be restricted. It is also important to ensure that the doors to the unit are closed completely when entering or leaving. Do not assist other people off a secure unit, as they may be a resident. We promote the minimal use of restraints. Using restraints can be harmful to your physical and mental health. A restraint is anything used to limit your ability to move your body or body parts. For example, a chair tabletop is considered a restraint if it is being used to prevent you from getting out of your chair. We urge you to talk to staff about our least restraint policy if you have any questions or concerns. Care must also be taken when bringing in food and beverage items. You and your family members should never share your food with other residents. They may have allergies that you are not aware of, or in some cases, dietary restrictions such as swallowing difficulties. Sharing the wrong food or beverage item could be harmful to their health. To prevent problems with insects or rodents, please do not leave your food by your bedside. Non-perishable food items such as crackers or mints should only be kept in covered containers in a cupboard. Not only is it important to provide you with safe care, but we also strive to ensure that the environment in our home is safe and healthy. Eastern Health promotes an environment free from tobacco and secondhand smoke. You, your family, visitors, volunteers, and staff are not permitted to smoke in the home or on its grounds, nor are staff permitted to assist residents off the grounds to smoke. Eastern Health is also scent-free. This means you should not wear perfume, scented sprays, or deodorants in the home. Many people experience health problems such as allergies, headaches, and asthma attacks. It is important for you to let staff know if you have any allergies and also to note if any residents or staff in your home has allergies. You must ensure that you do not bring in harmful items. Common items that are often restricted include poinsettias, Easter lilies, balloons with latex, nuts, shellfish, and bananas. Throughout the day, housekeeping staff will clean your room to ensure it is safe and clean. Rooms and cupboards are checked on a regular basis for food or perishable items. To help maintain a safe living environment, keep your personal items off the floor, away from heaters and waste containers. You must also get approval before bringing furniture and electrical items to your room. These items may pose a safety risk to you and others or be a fire hazard. Fire and electrical safety are always a concern. To help with fire and electrical safety, staff will need to be able to access your room at all times. Power bars must be approved prior to use, and items such as bedspreads and cords should be kept away from heaters. And please respect our fire lanes by not parking in them. Well-organized fire and safety plans are in place in each home. Smoke detectors, fire alarms, and fire extinguishers are also properly installed and maintained regularly by our maintenance staff. Our staff conducts monthly fire drills. It is important that you and your family follow directions from staff and the overhead announcements when an alarm sounds. Safety is everybody's responsibility. Please use the information in this video to ensure your safety and the safety of others. If you have any questions or concerns about your care or living environment, please discuss them with your care staff and the manager of your unit. Working together, we can be safe.